Hello, you're welcome. I'm Dr. Peter from Gary Physiotherapy. I want to talk to you about what happens after stroke. But before then, let's talk about how stroke comes in. Stroke doesn't just attack all of a sudden. Yeah, there are signs it must have been giving you which you neglected. There are signs it has given you over time you neglected or decide not to pay attention to it. For example, you're a diabetic patient and then or you are a high blood pressure patient, and then you get to a time where you begin to feel heaviness in your arm and leg, or you begin to feel severe headache. You begin to have issues with speech, not really obvious, but you kind of struggle at times to speak, and then sometimes you begin to have issues with blood visions. you know you feel like maybe you're having malaria. Yeah, we're quick to assume that it's malaria, but my dear, stroke is coming in and it's knocking. It doesn't just attack all of a sudden. Now, but if eventually it comes now, the stroke has come, what do you do? Yes, I know it's normal to panic. You're running up and down, trying to get solutions. People coming with so many suggestions about supplements, maybe Chinese supplements somewhere, Indian supplements, local supplements. But the truth is, there's no medicine that cures stroke. Yeah, I know there have been a lot of adverts online. Somebody was having stroke and he took this medicine. My dear, don't be deceived. There's no cure. There's no medicine that treats stroke. Even though stroke can be treated, but not with those medicines. They tell you this one can solve, this one can cure. It's a lie. There are procedures in taking care of stroke. Ischemic stroke is actually not as serious as the hemorrhage. The ischemic stroke has to do with blockage of the blood vessel. In other words, high cholesterol can form clot in the blood vessel, and so it will block oxygenated blood from getting to the brain. Yes, it will block oxygenated blood from getting to the brain, and so it shuts down the entire system. Now, when that is done, what happens is that every single day, you don't every single day, cells or the cell brains, the brain cells, sorry, begin to get weakened and eventually begins to die every single day. So you go to the hospital immediately the stroke has come, which is expected of you, but I don't expect you to stay more than maybe 2 days, 3 days maximum in the hospital, or even lesser than that. In the hospital, you go to your physio, you book with a physio. You can actually have a physio, you go to physiotherapy clinic, but then I would advise that you also have a home a physiotherapy that attends to you at home. That's home service, at least 3 times a week. When you are having issue with stroke, don't rely on 1 week appointment. No, go for 3 times a week appointment minimum, and then you can actually go for the physiotherapy clinic session maybe once a week. But make sure you attend to this issue at least 3 times a week. And now, there are a lot of drugs or a lot of supplements out there. Please be very careful so you don't add problems to what's already on ground. As I said earlier, there's no particular drug or medicine that treats stroke. But first thing you can do after you've been discharged, now you get drugs. I'm sure your doctor or the hospital will know the kind of drugs to give to you, either to control the BP, and then to control the sugar. That's one. So it has to be in a normal state. That's one. And then you get drug that takes care of cholesterol. Yeah, there are drugs that actually take care of cholesterol. So it clears the arteries. You get, it might not be at once, but it might take it over time. So it will clear the arteries, take care of the clots in the blood vessel, and then you need to get drug that takes care of the brain. And yeah, there are a lot of drugs and supplement that takes care of the brain that help you focus, and then it helps you to revitalize weak cells. I know when the arteries is cleared, you know, oxygenated blood can get to the brain. Now imagine yourself in a room where there's no ventilation. yourself in a room where there's no ventilation, there's no air, oxygen at all, you can't survive. You won't just die at once, but you'll be weakened. The body will be weakened. Okay, okay, or okay, for example, they throw a human in the water for a very long time. Even no matter how good you are in swimming, there's a maximum amount of time you spend in the water that you get exhausted. So you are in the middle of the ocean, inside the water, you can't come up. So there's no oxygen. You struggle. Then later you become weak, and eventually the person. That's exactly what happens to the cells when oxygenated blood doesn't get to the brain. There's no oxygen. When oxygen doesn't get to the brain, the cells of the brain begin to get weakened and eventually die. Then imagine you're having stroke, and what many people do most of the time is we focus more on rehab. We want to move our legs, we want to move our legs, our arms, we want to function. But then what happens? We leave the brain. The artery still there, blocked in a way, and then some people actually become okay for some times, yeah, and then what happens? The stroke comes back again, and when it comes back this time, it's always stronger than the previous one. Yes. Why? Because the brain have not healed. If the brain hasn't healed, I'm telling you, the person can't come back fully. The person can't come back fully, and it takes the brain. Though it depends on the number of days, weeks, months that the cells have been dormant. So, but normally, I know that cell brain doesn't heal quickly. Other part of the body can heal quickly, but not the brain. The brain can take up to 8, 9 months to get healed. That is, you don't miss a dose for a day. It has to be daily dose, you don't miss. And sometimes when you're doing that, so probably you have to take the drug for like a year. You get that? So these are some of the basic things you can know. Then from there, you get a physio that will attend to you, or take care of the rehab at home. And then weekly, you go to the hospital for normal assessment. You get that? God bless you. Please don't forget to like, share, and comment. God bless you. I wish you a beautiful health. Your days be long.